My name is Lucy Poolman, and I'm the Health and Wellness Coordinator at Thayer County Health Services. And today we're going to talk about metabolic syndrome and go over kind of what that means. And then we're also going to talk about your results that you should have all received by now and go over what those numbers mean as well. So first, though, is what is metabolic syndrome? Metabolic syndrome is not a disease, so it's not something that you're getting diagnosed with from a physician. But what it is it's a group of risk factors that when you put them together, it could put you at risk for type 2 diabetes and heart disease and other diseases in the future. These risk factors that we screened you for, so these are the risk factors that we were screening, these are the ones that compiled together could cause metabolic syndrome. So we're looking at high blood pressure, large waist circumference, high triglyceride level, low HDL cholesterol, and high glucose. You guys should have all received a form that looks something like this. Things are going to be highlighted in green and red. It should have your name, the screening date, and your weight up at the top. And as you can see, with risk factors that are considered to be within the healthy range that we're trying to look for will be highlighted in green, whereas the ones that are outside of what is the healthy range will be considered a metabolic risk factor. And if you have 3 or more things highlighted in red, or 3 or more risk factors, that would mean that you do have metabolic syndrome. So, so as you take a look at your different highlighted categories, you should see at the bottom, it'll say the number of risk factors, and you're going to make sure that that number lines up with how many you have highlighted in red. And if there's something off with that, please feel free to contact me and let me know. And then below that, it's going to say, am I metabolic? Again, if you have 3 or more, it should say yes, highlighted in red, and if you have less than 3, it's going to say no, highlighted in green. Below that, you're going to have your non-metabolic lab readings that we did, and that's going to be your cholesterol. So these are not considered in the metabolic screening category. However, they do still put you at risk for heart disease and stroke in the future. That's why it is important to know what these numbers are. So it will have your total cholesterol and your LDL. And then below that, at the very bottom, you're going to have your elective labs, which is going to be your TSH, your PSA, and your A1C. And so you can look at those numbers. We do have what should be those ranges, and if you notice anything is out of the ranges that we're looking for, you can always ask me about it, or I would encourage you to go talk to your physician about any of those readings if they are abnormal. So where should your numbers be? First off, these numbers are set by the American Heart Association. So they're not numbers that I came up with, but they are the guidelines for metabolic syndrome. So blood pressure, we are looking for a target range of less than 130 over 85. For waist circumference, we are looking at 40 inches or less for men and 35 inches or less for women. HDLs, we're looking at 40 and more for men and 50 and more for women. Triglycerides is going to be less than 150 and glucose less than 100. So now we're going to kind of talk about each category, what we're testing for, and what those numbers actually do mean. So with blood pressure is broken up into your systolic and diastolic pressures. Again, the target range we're looking for is 130 over 85. Your systolic pressure, what that is the maximum amount of pressure that is ever going to be on your arteries. So that is the pressure that is coming from your heartbeat. So that's why that number is going to be higher than the bottom number. And then your diastolic pressure, that is the amount of pressure that is on your arteries during the relaxation phase between your heartbeats. So that's going to be why that number is a lot lower, and that's going to be your least amount of pressure that's ever on your arteries. What causes high blood pressure? Usually it's kind of a combination of any of these risk factors for high blood pressure, and that's going to be a high sodium or a high-fat diet, a lot of alcohol consumption, so excess alcohol consumption, lack of physical activity, and physical activity, what happens with that is your heart is a muscle, so unlike any other muscle in your body, you do have to exercise it in order to strengthen it, so just like strength training, you have to do cardiovascular fitness in order to strengthen your heart. And when your heart is strong and where it needs to be, it's able to pump out blood to your body without having a high blood pressure. So it's able to pump it out with a normal pressure, whereas if your heart is not strong, it's not where it needs to be, it's going to need to have a higher pressure to pump out blood to the areas of your body when you're just having a normal, when you're just normal and at rest. Other risk factors can be being overweight and then also a stressful lifestyle as well. But like I said, it's usually a combination of some of those risk factors. Waist circumference. The reason that we are looking at your waist circumference is because excess fat around your waist can put you at potential risk for future disease. The numbers that we are looking for is 40 inches or less for men and 35 inches or less for women. This can put you at risk for increased insulin resistance, and what that is that would be type 2 diabetes. That is where your body does not react to insulin the way that it should. So your body's producing insulin, but it's not bringing your glucose levels down, and so they're remaining high. It can also cause a lot of stress on your joints and your bones, which can cause injury and pain in the future. And then it also will put you at an increased risk for coronary artery disease and or heart disease. Triglycerides. What triglycerides are is that is the fat that is found in your bloodstream. So that's what we're testing for. And this is coming from food that you have consumed that has not been used up as energy. So these are your carbohydrates, your sugars, your fats that you have consumed that if you weren't active, they're just going to be stored on your body as fat. But before they're stored on your body as fat, they have to go in your bloodstream as well. So if you are a person who's not very active and you eat a lot of carbohydrates or you're consuming a lot of fat, chances are your triglycerides are going to be elevated. Having a lot of triglycerides can put you at risk for type 2 diabetes, high blood pressure, and heart disease. And we are looking for less than 150. HDL cholesterol. This stands for high density lipoprotein and is also known as your good cholesterol. So there are good cholesterol and there are bad cholesterol. Your bad cholesterol is going to be your LDLs, which are not actually a risk factor for our metabolic syndrome. That was the ones that were below on your sheet. But having low HDLs is considered a risk factor. So what HDLs do is they help to keep your arteries clean and remove plaque buildup that is on them. That plaque is usually caused from bad cholesterol or having a lot of triglycerides. So if you have high HDLs, it's going to help to keep your arteries clean and flexible and prevent blockages. But so again, a lower risk will put you at, a lower number will put you at risk for heart disease and stroke in the future. So a little bit more about cholesterol. Now we're going to talk about, again, those numbers that were below. So these ones are not considered to be metabolic risk factors. However, if you do have outliers in these numbers, these will still put you at risk for heart disease and stroke in the future. So your low density lipoprotein, that is your bad cholesterol. And you want that number to be less than 130. And then you'll also have your total cholesterol number, which is your LDLs and your HDLs combined, and we want that to try and be less than 200 as well. But the main thing that we're looking for is your low density lipoprotein, those LDLs. We want to keep those low because that is what is going to cause the majority of plaque buildup in your arteries, which will cause your arteries to narrow, and so not as much blood can get through. And if you do have a blood clot or something that needs to get through, there is a lot higher chance that it will get stuck and cause a blockage. All right, but yes, so elevated LDLs and elevated cholesterol, again, will put you at risk for heart attack, stroke, and blockages in the future. Glucose. So glucose is one of the risk factors that we were testing for. Our target level for glucose is going to be less than 100. This is also known as your blood sugar. So this is it's the main source of energy for your body. So when you consume sugar and carbohydrates, it turns to glucose and sugar in your bloodstream, which is how we get our energy. But if you're consuming more than you need and you're not actually using it up as energy, chances are your glucose levels are going to be higher for a longer period of time. And it's also, what this will also do is make your pancreas that releases the insulin and creates your insulin in your body, it's going to make it have to work very hard in order to keep up with the high glucose levels, which will put you at risk for type 2 diabetes when your pancreas will eventually start to wear out from producing so much insulin. And then it also puts you at risk for insulin resistance as well, which we talked about earlier, and that's when you have so much insulin that's constantly coming into your body that your body is not going to react to insulin the way that it naturally should. So we are looking for less than 100 after you have fasted for at least 8 hours, and if you have over that, that can be a sign of prediabetes or diabetes. Alright, so the next steps, if you do have 3 or more risk factors, that means you are considered metabolic, you have metabolic syndrome, which, like I said, is not a disease, so we're not diagnosing you with the disease, but this is putting you at potential risk for diseases in the future. So you would want to look into wellness coaching, lifestyle changes, and that will lower your risk. My contact information is right here. I will also send that out to you guys. It should be on a letter that you found in your results that you received. But that's my contact information. You can also talk to Kelsey and Lori about wellness coaching if that is something that you're interested in.